Welcome, everyone. I'm just seeing our numbers climb in terms of participants as people are coming into the room. We'll get started in about a minute. Welcome. This webinar is on the role of family caregivers in older adult nutrition. And it is a partnered effort between the National Center for Health and Public Housing and the National Center for Equitable Care for Elders. And I think that I'm seeing our numbers even out. I'll ask my team member, Juliet, if there's no one else waiting to come in. Okay, we're good to go. So again, welcome everyone to our webinar today. We're really happy to be partnering with the National Center for Health and Public Housing. And my name is Christine Reedy. I'm with the National Center for Equitable Care for Elders. Both our partner and us are national training and technical assistance partners funded under HRSA. So about NCECE, our focus is on providing innovative and culturally competent models of care, interprofessional training, and technical assistance and educational resources to community health center professionals providing care to older adults. And these are the ways to stay connected with us. And so please connect with us if you haven't already done so. Next slide, Juliet. We are also working with the National Center for Health and Public Housing on this webinar, and I have our great colleague, Dr. Jose Leon, who will be introducing one of our guest speakers as well. And Jose, if you wanted to say anything briefly about your center, please unmute yourself and go ahead.
Thank you, Christine, and good afternoon or good morning, depending on where you are in the country. I know that Dawn is in San Diego, so good morning, Dawn, and everybody on that on the West Coast. So the National Center for Health and Public Housing provides training and technical assistance to community health centers across the nation. We work with 107 public housing primary care grantees, providing healthcare services and preventive services to those living in or immediately accessible to public housing. And as Dr. Reedy said, we are a national training and technical assistant partner working with other organizations trying to make sure that health centers receive the training and the technical assistance that they need to address their daily activities and priorities.
Thank you. And as we all know, we haven't completely come out of the COVID-19 pandemic. And so we just wanted to share the growing resources that are available on the Health Center Resource Clearinghouse, specifically related to COVID-19. But the Health Center Resource Clearinghouse is also a great site for many other resources related to training and technical assistance across many different areas, not just older adults and public housing. So please check that out. Just a couple of reminders. This is a webinar presentation, so please use the Q&A or chat box to ask a question during the session, and then we'll have Q&A at the end. And as you probably have already guessed, this webinar is being recorded. We will also email the materials, that is the recording, to the participants. And we do have a brief evaluation at the end. We love to get your feedback. It helps us in thinking about future activities as well as how this activity went today. And so please fill that out. And these are our objectives for today, essentially to understand the risk factors for malnutrition in community dwelling older adults, explaining the importance of tailoring dietary recommendations to personal and cultural preferences, and developing strategies for engaging family caregivers to improve their understanding of nutritional guidelines. So the focus really is on supporting the caregiver of older adults in of community dwelling older adults, with a special emphasis on public housing older adults. Next slide, please. So we have two wonderful guest speakers today. If you have been with us before on some of our nutrition related activities, you have probably heard Tara Hammes speak. She's a great partner, and I will introduce her, and then Dr. Leon will introduce Don Rutherford, who is our second guest speaker today. So Tara Hammes is the Director of Member Services for Nutrition within Massachusetts Council on Aging, the Massachusetts delegate to the Academy of Nutrition and Dietetics House of Delegates, and the member of the Massachusetts Commission on Malnutrition Prevention among Older Adults. She is a registered dietitian for over 20 years, and she has spent the last 10 years working on older adult community nutrition programs. So welcome, Tara. We're really happy to have you here, and you'll kick off our webinar.
Thank you very much. And I need to get you an updated photo, it looks like, because some changes have happened. Thank you very much. Thank you for asking me to participate. Again, I am so fond of everything that NCECE does, and I love to always share the information that pertains to older adults and how we can keep them as healthy as possible living in the community. And today I think is really exciting because we get to talk about how their caregivers can support those efforts as well. So I think Juliet has slides, correct? Okay, yeah, all right. So hopefully you're in the right spot. And I wanted to just pause for a second and share this slide because oftentimes caregivers are not appreciated enough, whether that is a family, a friend, someone who is hired, whether it's a visiting nurse or a home health aide, someone who is trying to provide support from hundreds of miles away, if not thousands of miles away. I think that it's wonderful to see so many folks invested in helping our older adults live the best lives that they can. And I know it can get challenging and a little stressful, but I wanted to say kudos to all of the caregivers. And we were just talking before this started about how it's Doctor's Day, and there was a it was Registered Dietitian Nutritionist Day. So I don't know if there's a Caregivers Day, but we probably should have looked that up beforehand. So thank you in advance. And hopefully, why have one dietitian when you can have two? So you're lucking out, you get two today. And I apologize if some of this is repetitive, but hopefully that means that it will stick better with you. Okay, next slide, please. So what's the process for today? My approach is I want to make sure folks understand the risk factors for malnutrition, that we can explain why it's important. We make our recommendations tailored to that individual, and then share, if not develop, some strategies on how you can support the older adult, just like you signed up for this webinar. So these are some general factors. What are the risk factors for malnutrition in community dwelling older adults or aging in place? Other than limited incomes, because we know that is the biggest factor. And we can do a whole nother session on support, financial support, food access, food resources, which we have and probably will touch on a little bit more today. But other than limited incomes, what contributes? We know that there's declining mental function. So it's hard, regardless of what that decline is or what the change in the brain health is, it's hard for folks to prepare or keep track of what they're eating. There are physical handicaps that get in the way. People usually think of, oh, it's too difficult to prepare food. You may not have the energy to stand long enough to cook food. But we even forget that it could be difficult carrying the food from the grocery store up the stairs, or multiple trips and transportation barriers. You can maybe only have a few bags at a time on the bus. Medication is, again, a whole separate topic. It can affect the appetite. It can affect not only the absorption, but also the elimination of nutrients. So it could be the digestion, the absorption, the elimination, all through the GI tract. Medication can impact it. And like I said, transportation. As we get older, oftentimes we can lose the ability to drive safely. And we might live in areas where there isn't sufficient transportation, whether that's public transportation or fixed routes provided by your Council on Aging. And I should have said this in the beginning, but I'll mention it now. Massachusetts has about 350 councils on aging and centers, and it ranges, they range from Boston being the largest and most heavily populated to some very small, very rural towns like Ashfield and Shelburne. And those folks have very different experiences and very different challenges to being able to obtain sufficient nutritious quality foods. I have a four-legged guest who might jump up and say hello, so bear with me. Okay. Go ahead, next slide. So I think it's really important that we have to dig in a little deeper with our older adults and not wait for the weight loss, right? But we need to ask specific questions. Not just what are you eating and how much, because we know a lot of times when we're asked certain questions, we think that we need to give a certain type of answer because that's what the questioner is asking for. So the answer could not be 100% accurate. So let's also ask, who are you living with? This is assuming that you don't already. Who do you eat with, and has that changed? We might have someone who recently lost their partner, and now they're faced with preparing foods, cooking by themselves. I am not alone, as you can see. And they might not want to cook for one, and it might be too difficult and emotionally challenging for them to keep up the same routine. Definitely make sure you're asking if they cook, what equipment do they use, and if that equipment works. I spent quite a bit of time in the emergency food system, and a lot of times some of the food that is distributed requires different types of heating or storage, and that person might not have a freezer. They might not have a working oven or range. They may only have a microwave, and it's really important to know that going in. Excuse you. Thank you. You want to find out where they're getting their food. Let's not assume that they're all going to a grocery store or a grocery store in town. Are they going to a food pantry? Are they getting meals from a community dining site? And how often are those sites open? A lot of times what I do is I have to make sure that we are identifying as many resources in the community as possible, because we know not one, just one will be sufficient. Sometimes even, and I wish this was more prevalent, but some hospitals will make sure that folks are given either prescription programs, produce prescription programs, or meal plans to an older adult as they're being discharged from the hospital to make sure that they aren't going home and just being left without sufficient foods. And if you're not sure where to start, then you can definitely go to the dietary guidelines. That this is a fact sheet, and I wrote out the full websites just so folks would have it in case you're not able to click on it for whatever reason. But this is a great fact sheet just to start that you can use when you're meeting with the older adult or the older adult and their caregivers, or even to give it to them so that they can go through the questions on their own. So these are a number of general issues that we need to make sure that we are asking to dig down for the details. We want to avoid older adult malnutrition. And if you need to determine if someone is malnourished or not, these are two evidence-based validated tools that you can use. The hunger vital sign is a series of 2 questions, and it asks if in the last 12 months, whether you were worried that you weren't going to have enough food or if the food was going to run out. And then this malnutrition screening tool is a validated tool created by Abbott, disclosure, no conflicts, but it's wonderful because that too is only 2 or 3 questions. And after you complete it, you are able, in theory, to take this tool to, if it's not somebody in the health center right there or someone else, another healthcare provider, and say, I'm at risk for malnutrition. What can you do to help me? So I think it's really nice to have this in hand as proof, so to speak. Next slide. So a number of you have probably already heard, and I'm assuming that Dawn has, so we won't ask Dawn the question. What is the tea and toast syndrome? Is it how you eat when you're sick? Is it eating the same thing every day? Is it the millennial generation's insult of British culture? Or is it a way of eating among older adults contributing to malnutrition? And I'm going to assume, because I saw so many hands go up, that it is the last option. It is this syndrome where not a lot of nutrient dense food is consumed. You might be making some toast, you might be making some tea and having them together and calling that just enough to eat. But we know that it isn't. So we want to make sure that we can avoid this syndrome as well. There are a number of other tools that we can use in helping to increase their consumption of nutrient dense foods. But first we have to identify those specific issues. We talked about some general issues a few slides back, but some specific issues around aging are decreasing, fading senses, smell, taste, your taste buds diminish. Things don't taste the same, they don't smell the same. So we need to make sure that the foods are more visually appearing, they have stronger flavors and aromas, ones that will be encourage folks to eat, not the aromas that they don't like. Obviously, physical handicaps are a big piece, not just in carrying your foods around, but also chopping, slicing, making sure that the bowl doesn't move across the counter, and making sure that the pot stays in place. And there are a couple, I'll put a couple of links in the chat for you as well. But one is, actually there's one in the slides, but a separate one that I wanted to mention is just the OXO brands. They have a great line of larger grip items that make cooking easier, from chopping to even just the floor mats for comfort. Dental health is a big issue for older adults. It can be hard to chew properly, so that can contribute to the tea and toast syndrome as well. It's okay to encourage folks to mince their food, to eat canned vegetables. They don't need to buy low sodium vegetables if that's something they're worried about. They can rinse what's in the can already and save themselves, you know, a couple of cents with each can. Drink your juice, eat your canned fruits, whatever it is that makes their diet just a little bit better, because we're not trying to overhaul every single thing that folks do, especially as they get older. because there could be quite a bit of resistance. We just want to try to move the needle to help them eat a little bit better and help support them. So the transportation is also another issue. How do we get folks to meal programs? How do we get folks to the stores? What's the safest way to go? We want folks to continue to dine out if that's something that they would like to do. We can look for restaurants that have the purple table programs, where it's a little less stimulating for folks with cognitive issues or hearing and visual sensitivities. And two of the biggest issues, specific issues around making sure that we have solutions are isolation and potentially accompanying depression. How can we make sure that we can visit with folks? Can we take them to lunch? Can we sign them up for the meal programs? Can we teach them how to shop or cook for one? Is there a batch meal club around? I know some people always look at me funny and be like, a batch meal club, sort of like a book club. But folks can get together and make large amounts of food, portion them, and then share. And then people have the variety and quite a bit of options, and they don't have to work as much to get them prepared. Some restaurants will have older adult only seatings as well as the discounts. And also don't forget, if you have universities in your area, they may be open to either having an older adult, an hour, or allow folks to come on into the cafeteria as well for discount meals. So anyway, those are some specific issues and solutions that we can add to our toolkit. Next slide. All right. So obviously we need to tailor the recommendations, not just to the specific issues around aging, but then also their personal and cultural preferences. As you can see, each of these four gentlemen has a different preference or ability for eating and preparing their food. Someone who is practicing Muslim versus someone who is an amputee might have a harder time standing and preparing foods. The dentition we've already mentioned is an issue. And that's my boyfriend Cookie Monster at the end right there, because I always say, if he were human, I would have been married in the 3rd grade. So we definitely need to make sure that we are making recommendations that fit with their lifestyle. Next slide. I mentioned before the OXO tools. This is one other option for folks, and that is Active Forever. This is just a store that you can go to. You can Google it. You can go on Amazon. Even if you don't know what the older adult might need, ask them when you have them in your office or in the exam room. What is it that you would like help with? It might be something they need to help cut and chop. It might be something along the lines of a cookbook, or how do I cook for one? My Plate Kitchen, so My Plate is part of USDA, and they, over the last couple of years, have created this great feature, which they've also modernized. And this site, I think it's on the next slide, Juliet. It is, there you go. So if you go to My Plate Kitchen, you can search for a specific type of food, but then you can also refine it by the type of cooking equipment, by the type of cuisine, by the amount of money that it will cost. This also gives you the flexibility to prepare, to choose a recipe that yields 2 or 20. And I've found that it's a pretty flexible solution on more times than one. So what are some other strategies for engaging the caregivers? Not everyone is going to want to have that hot pan of liver and onions. I know I would take a hard pass on that one. So make sure you listen to identify listen to what they need and identify a solution that fits for them. We already mentioned the cookbook. Where do you send them for food? They might be SNAP recipients, and not all markets will take SNAP. If you are looking for very specific foods that are best for older adults, I'm going to encourage you to look at the Dietary Guidelines for Americans, the new version that came out, starting in chapter 6, page 121, is where you'll find the information for older adults. What are the best foods? I would say nutrients, but we eat food, not nutrients. What are the best strategies and techniques? Make sure that folks are hydrated as well as eating the best foods, the most nutritious. And then 2, if you want to send them home with a specific meal plan, you can look at the DASH diet. They have a 1-week plan. My Plate that we were just looking at has a 2-week plan. You can just download those and make sure that the foods are appropriate for what your older adult needs. You can also look at some that are more culturally appropriate, like the Old Ways Institute. They have specific food groups and recipes and meal plans for Mediterranean diet, Latin diet, African heritage diet, and I'll put that link in the chat as well. And next slide. Okay. So for resources, I do want to touch on the financial part of it, because I think a lot of times it's not overlooked, but not sufficiently examined. We know about meal programs. We know about home delivered meals, but there's also a number of other federal programs like the Commodity Supplemental Food Program, farmers market coupons that come out once a year. There's in Massachusetts a program called the Healthy Incentive Program, and that is a program which provides additional resources for fruits and vegetables. Once you are enrolled in SNAP, you're automatically enrolled in HIP. And I encourage you to reach out to your local state office administering SNAP and find out what the average dollar amount is for an older adult who is single living alone. And I do that every 6 months now for all of the towns and cities in Massachusetts, so that I can go to each of our COAs, encourage folks to screen for SNAP or have them apply for SNAP, because they don't know really how much they could get. And I'll say over the past 2 years during the pandemic, with the emergency declarations in place, most of the older adults were receiving the max, which again, in January increased. And so it was I think it was $240 a month, every month. And that is before the additional HIP that they would get. So they were getting almost $300 a month. Not too bad. The pandemic EBT is the SNAP funds that went to school age kids. And I share this because there are a lot of grandparents raising grandchildren, and I want to make sure that they are capitalizing on every single resource available to them. And that's also why I put WIC in there, because 0 to 5, and if you're caring for that child, then you're entitled to WIC as well. All right, next slide. If you're not sure where to start, I did create a community checklist that you can use in your area and just run through all of the questions so you can identify the resources in your town, so that you'll be better prepared the next time you are working with an older adult or any of the caregivers and their families. Next slide. Oh, and there you go. So I will leave you with this image, because yes, we have the tea, and yes, we could have toast on the side. And even if it's just the tea and the toast syndrome, there are other things that we can add to it: peanut butter, avocado, eggs, what have you. So like I was saying before, it will take a number of resources for caregivers to make sure that our older adults are eating sufficiently, just as we have a number of ingredients to put on the toast. So thank you very much for having me. And I'm going to check the chat and see if I missed any of the links that I know was being put in there for me. So thank you.
Thank you so much, Tara. So I'm going to turn it over to Dr. Leon and Don Rutherford.
Thank you, and I am very pleased to introduce our second panelist for today's webinar, Dawn Rutherford. Dawn received her Bachelor of Business Administration from James Madison University, and after a career in sales and marketing, including starting a lifestyle tour company and real estate, she went back to school to be a registered dietitian nutritionist, RDN. Her journey to become an RDN included receiving a master's degree in nutritional science from San Diego State University and completing a dietetic internship specializing in leadership from Sodexo USA with rotations at Sharp hospitals, Microsoft, and community clinics. As an RDN, Dawn has worked at numerous PACE programs and skilled nursing facilities. She was also the general editor for a 3-volume nutrition encyclopedia published in 2016. Dawn currently resides in San Diego, California, and works for San Diego PACE, overseeing the nutrition department for 4 centers. She's passionate about making sure the seniors under her care receive adequate and proper nutrition. In her free time, Dawn enjoys spending time with her husband, 4-month-old baby girl, and their sweet golden retriever, Duke. Thank you, Dawn, and good afternoon or good morning to you.
Good morning, good afternoon. Thank you, Dr. Leon, for that very nice introduction. And that was great information, Tara. Thank you so much. Some of my presentation will be a little bit repetitive, but I'm actually going to be focusing more on where I work, which is San Diego PACE, and the role of the registered dietitian on our team with helping the participants that we care for, as well as the caregivers in older adult nutrition. So just to start off, I'll do a little bit of a background in case people are not too familiar with the PACE program. PACE stands for the Program of All-Inclusive Care for the Elderly. So it is a health plan with the primary care provider, and it includes comprehensive coverage for medical, dental, vision, medication, and long-term care. So our mission at San Diego PACE is to ensure that seniors get the care they need to lead healthy, happy, and independent lives. So here's an image just to show you what some of our PACE facilities look like. These are the centers where when a participant is enrolled in PACE, they can attend. So our transportation vans, they pick up the participants and bring them in, and they can enjoy the beautiful day centers all around San Diego where they can participate in activities, enjoy meals. We serve breakfast, lunch, and snacks in our centers, and they can also attend their clinic appointments at the same time. So to qualify for PACE, you must be 55 years or older, live in the qualifying zip code, and have a medical condition to qualify to be in the program. So typically that would be something like dementia, depression, diabetes, hypertension, or cardiovascular disease. So the need for some kind of level of medical care. And then PACE is free if you qualify and with no out-of-pocket cost Medi-Cal. So PACE participants have the ability to live safely in the community with the assistance of the PACE services when they're needed. And the participants are free to disenroll at any time if they want to. So basically, we're a one-stop shop for all of a participant's needs. We offer all of these services that you see up on the screen and even more sometimes. And next slide. Okay, so the magic of PACE is actually due to the work of the interdisciplinary team. So we all work together to create individualized care plans for each and every participant. So there's 11 disciplines that meet every single day and discuss all the pertinent needs for participants and come up with interventions to help make sure that they are staying safe in the community. And you see I have an arrow there to the registered dietitian on the team. And our main objective is to avoid malnutrition in the older adults that we serve. So the dietitian's mission is basically to make sure that the older adults that we're serving have access to and are consuming the right foods to optimize their nutritional status. We also provide education and support and strategies to the participants and the caregivers to help prevent malnutrition. So the medical issues due to the natural aging process, along with socioeconomic status, can make caring for aging family members, friends, and patients extremely complex and challenging. And I've listed here some of the most frequent conditions that can lead to malnutrition in older adults. And I'll be going through and discussing some of the solutions that we practice every day to handle each of these ailments. So the first one I want to talk about is dysphagia. And dysphagia is the medical term that means difficulty swallowing. Basically, as we all age, our muscles all over our body become weaker, including the muscles that we use for swallowing. So the dietitians and speech therapists work really closely to come up with the least restrictive diets, medically altered texture diets, to make sure that our participants are able to swallow the foods that they're eating. So this can range from chopping up the food, making it a more of a ground consistency, or if needed, all the way to a blended pureed texture. Also, sometimes older adults are having difficulty swallowing thin liquids. So again, along with speech therapy, we come up with the least restrictive thickened liquid that they're safe to swallow, so it doesn't go down the wrong way and end up in their lungs, potentially causing aspiration pneumonia, which is a very common reason that older adults end up in the hospital. So with the thickened liquids, it can be anywhere from a nectar thick consistency to honey thick, and then all the way to pudding thick. And then in some cases, seniors just are not able to swallow at all. They lose their ability to safely swallow, and that's when there could be a need for enteral nutrition, or otherwise known as tube feeding. And then another condition that's extremely common is dementia. And some of the things that we do to help with making sure that participants with dementia are receiving adequate nutrition is we educate about kind of altering the meal times. So it's very common for participants with dementia to have sundowning behaviors, is where it's when they become more agitated, when they are more confused in the evenings, and they sometimes just don't want to eat. They don't think about eating. So we educate to offer larger portions for breakfast and lunch when they're more alert and they're more excited about their meals. So you can kind of offer more calories and more items that they're going to enjoy earlier in the day. And then as the day goes on, you could offer something more simple, even like a can of Ensure or Boost, or make them a milkshake, something kind of like sweet and easy to eat or drink in the evening hours when they might be a little bit more confused. So another thing that helps that we find with our participants with dementia is community dining. And when they come into our centers, they love to eat together. Just being in that setting can help them eat more, because they're just enjoying their environment. And next slide. So, you know, with everything, when there's a combination of problems, it really can make things a lot more difficult. So dysphagia plus dementia, I call the double Ds, that can be a very complex situation to try to maintain a proper nutritional status. So some of the things that we do is make sure that the foods that we're offering are different colors. So it's not just one color on the plate, and you have a variety of color that helps it more, you know, look more attractive. And also ideas to increase the palatability of the meal is to add like seasonings. You can do savory seasonings. Like if somebody like, you know, is more into the salty flavor, you can, you know, add on some kind of seasoning, or like if not salt, if they have other issues that you don't want them to have salt, you can do like a Mrs. Dash or something, a salt-free substitute. You can also add some kind of sweet to foods, like a sweet and low or sugar, because these senses are kind of the last ones to go. So if you add more flavor, then it makes older adults more interested in eating the food. Also, you can see the picture here, there you can use a food mold. So if somebody is recommended to be on a pureed diet and they have dementia, you know, if you give them food that just looks like a blob, they're not as likely to want to eat it. But you can use these food molds that you basically put it over the pureed food, and it can, you know, based on what the food is, you can make it look like it looked in its original state. So that's kind of a clever way to combat that problem. Next slide. Okay, and then Tara was talking about this as well. Poor dentition is very, very common. Older adults have some missing teeth, or their dentures are not fitting well. So again, you want to offer softer foods and make sure that they're able to chew the food. A lot of times offering foods that are naturally soft versus blending up a food could be tolerated better. And then something I like to recommend as well is adding like protein, like meats, into a soup and blending it all together. So they're eating a soup and they don't feel like they're eating blended up food, so then you're adding in protein into that soup. So if you have a can of chicken noodle soup that doesn't have a lot of nutrition, you can add vegetables, you can add chicken into that and blend it all up to the pureed consistency, and then you have a more nutrient dense meal. Also offering like high calorie smoothies, you can add in protein with peanut butter or yogurt. So again, just kind of trying to make things as close to like a natural state, but still being safe to eat because it's really, really nice and soft. Another thing that happens is as we age, we lose some of our senses like taste and smell and eyesight and our sense of thirst. So again, we want to add seasoning to food. We want to make it more visually appealing with bright colors, maybe with garnishes. Also, we have to promote adequate hydration for older adults, because if they have lost their sense of thirst, they're just not going to think to drink a lot and they're going to end up getting dehydrated. So you can do things like in our PACE day centers, we have big containers with fruit infused water, like you see in like a hotel lobby. So that entices them, it looks pretty, it makes them more excited to want to go drink some water. You can also add in some of the sugar-free flavor drops that they have on the market. And having participants have like a nice fun water bottle that can also help keep the water cold, and kind of, you know, it's something that they carry around and they're more likely to fill that up and keep drinking adequate water throughout the day. Another problem, like where, again, we have to remember to promote adequate hydration for older adults, is that sometimes they purposely don't drink water because they could be on certain medications like a diuretic, where when they drink water, it's making them go to the bathroom too much. And they don't want to do that, or it's difficult for them to get up and they don't want to get up to go to the bathroom. A lot of falls end up occurring like in the middle of the night when older adults are getting up to use the restroom. So it is a common issue that you again have to find ways to be creative and encourage older adults to drink enough water. Okay, and then also as we age, we have decreased mobility, we have decreased motor skills. Some of the solutions that we use is we work with occupational therapy a lot to determine which adaptive equipment will help older adults continue to eat independently and also with dignity. So it's really important to try to keep our participants able to feed themselves for as long as possible. And to do so, there's definitely equipment that you can use. If like sometimes they start having like hand tremors or something like that. So having a divided plate, as you see on the screen here, that helps prevent all the food from mixing all together. And that's, you know, can be like not as appealing for people. Also, built up equipment helps you have an easier grip so you can feed yourself. The cup with a top on it and handles that can help prevent spilling if, you know, their hands are shaking a little bit. And then clothing protectors. So if they do have a spill, their clothes aren't all stained and marked up. So those are just some of that's some of the equipment that we use pretty often. And then for caregivers to, you know, just kind of watch and see if somebody needs that assistance with feeding, you know, even if it's just helping to cut up a few items that they're eating, or opening some packages, you know, even like just like the condiments, or if they are preparing, if they're able to prepare their own meal, making sure that they have it, they're able to open the package to heat it up. So looking for those kind of barriers to try to keep people feeding themselves independently. Another issue as well that Tara had mentioned is just some common GI issues that happen a lot of times due to medication side effects. They can cause diarrhea, constipation, people can have heartburn. This can cause older adults to limit and avoid certain foods, which again can start to lead to malnutrition. So you want to ask questions and be aware and make sure that you know, there's a dietitian involved to make sure that the older adult is getting enough of all the nutrition that they need and not over restricting. So, and then in some cases, if the digestive system is just not working, it could potentially be an indication for tube feeding, or in more extreme cases, parenteral nutrition. That's if their system is not working at all, then we could potentially have to do TPN or feeding through the veins. So dietary restrictions for chronic diseases. So I always try to tell my participants that, you know, eating, following the recommendations for type 2 diabetes and heart disease and hypertension, when you follow the education that we provide, it's really the way I think everybody should eat. You want to try to eat small, frequent meals, not too many carbohydrates. You want to have enough protein. You want to have a variety of foods. Like I say, eat the rainbow, you know, and kind of diabetes and heart disease. I feel like it's a similar eating pattern. You want to decrease your salt intake, and just really make sure that your focus is on as many healthy foods as possible. End-stage renal disease, that's also a condition where there's specific restrictions based on the frequent lab data that we're receiving. We're in very close contact with renal dietitians at dialysis centers. So sometimes we have to restrict foods that are high in potassium and phosphorus. Also coordinate with our participants to make sure they're taking their binders at the right times with meals. Obesity, that's definitely something that a lot of our participants struggle with. Sometimes they're on a planned weight loss regime that we work with them to make sure that they're still getting adequate nutrition. You can actually be malnourished and obese at the same time. So we really work to make sure that participants that are trying to lose weight are doing it in a safe way. Especially sometimes we have participants that are trying to qualify for bariatric surgery, and they need to be following very specific meal patterns and diet education. So another factor aside from the medical issues and concerns is lifestyle risks for malnutrition in older adults. Sometimes, they just, like the tea and toast, that Tara was talking about, it's a lack of knowledge about food and cooking and nutrition and why it's important to have a variety. Especially in the last couple of years with the pandemic, seniors were very isolated and lonely. And, like, as I mentioned before, older adults they eat better. I think we all eat better when we're around other people. So that is a common cause for malnutrition. Food insecurity is the disruption of food intake or eating patterns because of the lack of money and other resources. So that's a very, very big problem. Some of the causes, next slide, please. Some of the causes for food insecurity is living in a food desert. So that's when they just don't have access to grocery stores or restaurants. They have decreased mobility, so they can't get around very easily. They don't drive, they don't have a car. There's no transportation for them to get places, to get out of the food desert where they live and get some food. They're unable to work due to disabilities or just, age. They have a very, very low income or a fixed income, and the money runs out every single month. So they have to be really careful about like what foods they're buying and everything. Sometimes there's a language barrier where it's difficult to get information and find out about some of the resources that I'm going to talk about here on the next slide, please. Okay, so there are a lot of solutions for older adults for food insecurity. So every area has community centers, senior programs. Really just Googling where, just Google community senior program and in your town and see what comes up. There are so many resources out there, and a lot of people just sometimes don't know about them. I'm a big advocate. I'm talking all about the PACE programs, and PACE is a nationwide program. So I work at San Diego PACE, but there's PACE programs all over the country. So checking to see if there's one in your area, or that, potentially if they could get enrolled into PACE, it takes a huge burden off of caregivers because we take on a lot of the responsibility of caring for our participants. And then another is SNAP. It's called CalFresh in California, but the EBD cards, making sure that if they're qualified, get your older adult friends and family members enrolled into this, because even if you have to help them with the grocery shopping, at least they'll have the money to get the food. There's a lot of home delivered meal programs. There's Meals on Wheels. There's other senior meal deliveries. Here in San Diego, there's Mama's Kitchen, Mom's Meals, the Jewish Community Center, just to name a few. And then, all of the education that we as dietitians do every day about shopping smart, making your money go far, buying shelf-stable foods that are going to last longer, buying frozen versus fresh. Frozen foods retain their nutritional value. They're frozen in time, and they're generally less expensive than fresh foods, and obviously last a lot longer. if you do buy fresh food, then cut it up, like wash it, cut it up, and then put it in the freezer. I hate when I buy fresh, nice produce and it goes bad before I'm able to eat it. So I'm a big fan of making sure I put things in the freezer to keep them fresh. And then making sure to get convenient foods that are easy to eat, they're ready to eat, easy to heat up. Like even if it's like little prepared TV dinners or something like that, that, you know, as long as they can just get up and put it in the microwave and have a hot meal, then that's better than not having, you know, or it's better than not having having a meal, or, you know, to eat a prepared dinner versus just having a pizza. It's good to have some of all of the food groups. And then with the help of a dietitian, the education that we provide to our participants and the families, they can choose more nutritionally dense foods that are higher in calories and protein. Okay, next slide. So some strategies to help engage the caregivers. There are a lot of resources out there. There are classes, workshops, events, there's support groups, there's adult day centers. Sometimes, you know, that they can offer respite to help prevent caregiver burnout. That is something that we do offer at PACE. And then look into getting a consult with a registered dietitian, because that's really what we specialize in. We, you know, we can look at all the individual needs and come up with a good plan. We can help the caregivers come up with the best plan to make sure that the older adult that they're caring for has all of the proper nutrition, and just some tricks and ideas to really keep them from becoming malnourished. And then I put a link right here that's just a caregiver center that's for California, but just to get an idea, you know, there are these resources where you can just do a little bit of research, and there's help. There is help. And if you don't have a dietitian or don't know how to look for one, just ask your doctor and they can usually give you a referral. All right, and there is my contact information, and I'm happy to answer any questions.
Thank you so much, Tara and Dawn. A lot of great information, and I know that there's information that was shared in the chat. As we mentioned earlier, we'll make the slides available to all the participants, because there's a lot of great resources in the slides and the chat, so that you can take advantage of those. We have, I think, my 2 minutes just changed to 1 minute. If you have any questions, please reach out to us after the webinar. We're happy to answer any questions, put you in touch with Dawn or Tara if you have questions for them. And we really appreciate you taking the time to attend our webinar today, and also appreciate you taking a moment to provide feedback by completing our brief survey. So thank you again to our presenters. Thank you, Dr. Leone, for your partnership in putting this webinar on, and we hope that everyone has a great day and a good week.